Well, welcome to the third meeting of SaludArte. This big station over here is the memory map station. These aren't all encompassing, but we tried to get as much areas of Tucson as we could. Our communities are our biggest asset. Art and health initiatives are becoming an emerging best practice in Pima County. Go off the cuff and talk more about your experiences.
I have some biases as an artist as to what art can do with what may be perceived as controversial subjects. Art gives us a way into the conversation.
You know, when they build a road, they say 1% of the road should go to public art. Well, I believe that 1% of public health funding, at least 1%, should go to public art. Public art so embodies what it means to help heal. So we created this vision that became SaludArte.
In thinking through how might we do this, especially as a public health institution, was thinking through who should we partner with to really steward this work. And so I reached out to Adriana Gallego, the executive director of the Arts Foundation for Tucson in Southern Arizona, fomenting what ended up being like a really, really solid partnership that allowed us to create this beautiful public offering.
The arts alone will not resolve society's issues, but society's issues will not be resolved without the arts. This was a situation where we could build a bridge between community members, between government, and between arts and culture, so that together we could tell a story of resilience, we could tell a story in memoriam of the losses that we endured, and we can tell a story about hope in the future.
With SaludArte, what we ended up doing was working with the 5 different superintendents areas in Pima County. Art is not a typical fund from either Health and Human Services or from the Center of Disease Control. We had to convince them that art mattered.
We decided to pair longitudinal COVID-19 data with data called the Social Vulnerability Index. And it looks at underserved communities and how are they impacted by access to health resources, to health insurance, again, to employment, to education. What are all of these different social factors that go into making people more or less vulnerable?
We also were really focused on this concept of human-centered design, that we would ensure that the community itself was engaged in figuring out what art they thought would matter to their community, working with the artists during the time period to create that art, and then be there at the time when the art was revealed.
Worked with the Pima County Health Department team to identify the locations that we were going to be working in. Once we did find the zip codes that experienced the greatest loss and were the most under-resourced across Pima County, I went to each of those communities. From there, I did outreach looking for at least 15 folks who would like to join in the program. From managing the program, I've seen how transformative it can be with communities. I'm also managing the next iteration of SaludArte. For this iteration, we're focusing on substance use.
The project is funded by the Overdose Data to Action grant from the Centers for Disease Control and Prevention. That's a 5-year grant, so that's going to go for another 3 years from now. We plan to continue funding artwork as a part of that project.
We needed to think of creative ways in which the arts be part of the solution.
We're inviting people with living and lived experience of drug use, of recovery, of well-being, of being on a journey to well-being, to share different parts of their story.
Around windows downtown, we're putting up vinyl stickers of quotes people have about recovery or about what they would tell their past selves if they could. And as you walk by it, there are QR codes that you can go to and listen to what the person fully said.
You know, there's a tradition of socially engaged art that the things that are made are the product of the process of bringing people together rather than the product of an artist producing in the studio.
By the end of this project, so many community members, it sparked in them a desire to become more civically engaged. And we know in public health, the more civically engaged individuals and communities are, the healthier they are.
The Tucson Museum of Art is displaying the process product of Elizabeth Burden's installation. So after working with the Arts Foundation and working with the Pima County Health Department, parts of the project that is documented as well as final artistic end products are on view. Dealing with this idea of addiction and destigmatizing substance use, we're seeing an opportunity to act local, but with a topic that impacts a global spectrum.
At the table here tonight, we've got a box full of wooden butterflies that have names and dates on them. And those are all names and dates of people from our community who have been lost to overdose. And at the end of this OD2A project, that's going to be part of a larger artwork that's going to be an installation. So that was one of the beginning phases for understanding this connection of art, and especially as it pertained to healing.
The idea of planting a seed resonates for this particular project. There is a saying among persons in recovery that the opposite of addiction is not sobriety, it's connection.
The actual space itself, the recovery living room, a place where you're just in communion with another human being. But just by sitting down with someone, breaking bread, drinking water, eating food, and having a conversation about life, like these barriers start to disappear, and it creates this immense sense of hope and connectivity. There's been lots of interactions that we've had with people from our community that have lost someone. And when someone comes up to you and says, I've never had an opportunity to express this loss before because I've never been able to talk about it because there's been so much stigma about it, to give them an opportunity to heal and to start that journey of recovery has been really meaningful work.
Our real goal was to say, and this is a quote I actually took from what someone wrote at one of those celebrations, is that all healing is possible. And that became a guiding star for us, that our work with and of the community was really to help give people another venue to heal.
Hi, I'm Tom McNamara, host of Arizona Illustrated. Thanks so much for watching this story from our show. And for more local stories from Arizona Illustrated, just click right here.